Give me a second, and because I'm not also playing, I'm doing my job. I had some complication.
Does the patient feeling sometimes like uncomfortable in this way?
Hello and welcome to a new episode of Etc. Podcast, your favorite podcast where we break taboos in medical tourism and host special guests who are insiders from the industry, who will provide us with valuable insights and information to insiders such as yourselves.
And today we have a special guest, had more than 3 years experience in medical tourism, successfully transferred his knowledge into patient experience. Thaer Alesmaiel, aka Sam. Welcome to our podcast. Thank you for joining us.
Thank you for having me.
Thank you for coming, Sam.
Thank you for having me. Happy to be here. And I have been following you guys for a while.
Oh,
yeah.
One of our audience. Thanks so much for following.
My pleasure.
Coming here means a lot to us.
Thank you so much.
Thank you. Let's kick off with the first question. Like all, we're asking, what the first drew you into medical tourism?
Actually, it was an advice by my friend. We were just having coffee and we were talking about something. And he just told me something. You're a really good communicator.
Okay.
And he advised me at that time that I get a career with communication. So I started to look and then I found out that medical tourism is a big thing here.
Yes.
So since that day, I started to look and I found my first
job in medical tourism.
It was in sales.
It was in sales.
Yes,
Your first position was immediately
was in sales,
in
yes.
telesales specifically.
Yes. Sales
Phenomenal,
over the phone.
phenomenal.
Yeah.
And what inspired you to enter the career of patient experience?
After doing the sales for a while, I encountered a lot of situations. People with very bad teeth, very bad mouth, very bad things that actually was pushed me to help people more. So after doing the sales for like over a year, and I went to the hospital once and I sat with one of the patients who was my patient. And he was very happy by the results we did to him. And the feeling that I got from that moment was the switch for me. And so
the satisfaction
exactly,
that you get.
the face-to-face satisfaction.
Yeah.
And then I was like thinking, what I can do this every day, how that's going to feel. So, and then I spoke to one of my colleagues and I got another position and started that.
So perfect.
You found yourself more communicating with patients face-to-face rather than
exactly.
over the phone.
After that encounter with that patient, I felt this, like, I have to do this more. It was interesting. Because I mentioned to you before we start that I felt like before I was an introvert. And then when I met that patient and I started talking with him, I realized like, oh no, I'm not an introvert.
Well, yeah,
I actually can talk to people.
In your line of work, in your job, you are the furthest thing from introvert that could be possible.
I am very talkative at work, and actually, it's just something that it was very useful for me. And whenever I meet a patient, I have access to their information, where they're from, which country. So I have also some knowledge about cultures around the world.
Yeah, exactly.
So and most of our patients, actually, they're from the USA. And I follow sports a lot. So the first thing I kick out, especially with the guys, is about the football.
The icebreaker.
Exactly. It helps to get into the conversation with them. And it's really interesting, yes.
Phenomenal.
Yes.
And you working as a patient experience specialist, mean you are seeing the entire stages of the patient experience, like from the moment they land to the moment they come for initial consultation to the beginning of the work.
Definitely.
So you see all of these stages. In your opinion, what are the most important stages when it comes to patient experience?
The communication is first, because most of the patient are uninformed.
Uninformed.
Yes.
Okay.
They come like, what are we doing now? Nobody told us anything. We don't know which, like,
no plan for him.
We don't know who did the wrong thing. We don't know who didn't inform. Some patient that actually informed, but they just forget, or some patient they're not really informed. So it's not something that we have to look into. We have to get to next stage to informing, which is here, which comes my job. So when they say we weren't informed, so I'm like, we're going to do this, do that.
You explained the entire.
Exactly.
What he's gonna do,
and they feel more, much more aware of what they are and what they're gonna do.
Also, he can like arrange some plans for him, like to see Istanbul, maybe like to see some places.
Yeah, that's very
because
valuable
as I
point.
mentioned, they have the conviction that they are coming to have a treatment and they're going to have a little bit of holiday. So
yeah, of course.
here comes my job to
Advise them on where to go.
Exactly. A lot of them ask me where the nice place to go out.
Yes,
So yeah,
how can parties sometimes
exactly, clubs and
And
stuff.
you know, I have to agree with you a lot on this point. Working in this industry for so many years, I've seen this. Like sales agents over the phone are very much goal oriented. I want to make the sale, right? And they focus so much on the result. You will have the best implant. Your teeth will be so good. You'll be super confident. Most of the time, they miss
forget the journey.
talking about the process, like how the process would go.
Exactly.
And when I train agents, I always tell them, like, guys, focus on the process. Patients should be informed. So kudos to you for actually relieving the patients, giving them this information. I'm sure it helps a lot.
Exactly. It helps a lot. And I think when I was in sales, I did some couple of times forget to mention this to the patients.
Natural.
Yes. But then after that encounter with the patient, I was more detailed with all the patients. Like when you arrive, we're going to take an x-ray and then you will meet the doctors and then we'll discuss your plan, to the end.
Exactly.
But when I was in the clinic, it was more than that.
Of course.
It was more detailed. Like some patient will tell you, if they come today, tomorrow what we are going to do.
Yes.
And you don't have all the answers all the time. So you have to be on your toes, you have to be like, okay, give me a second, and it's really busy sometimes, especially on Mondays. We have a lot of new patients, and
Mondays, yes.
Exactly.
I know Mondays.
You have patients still during the treatment, and you have patient they're about to finish. You have to coordinate all of that.
That's
on Monday.
A lot of work.
So Monday I'm off the gym. I don't go to the gym.
Sam, we see some sales are making sales with the patients or with patients coming from abroad. They're not speaking the same language.
Yeah.
For sure, they are selling through ChatGPT sometimes. So could you just tell us about a situation like a difficult situation that you have been handled with the patient doesn't speak your language?
I think we had a problem once with a patient who speaks German.
Okay.
But we were able to handle it immediately using ChatGPT, of course. But the first thing I would say is care. Care is a universal language.
True.
Showing the patient that I care about you was more important than speaking in his language.
Non-verbal. You see, non-verbal cues are so important.
Showing him like you can have a seat. Do you want coffee? I used the sign language a lot at that time. And he was very happy that I was helpful to him. And then until we got to the point that we need ChatGPT and we need to talk to the doctors, we already solved that. And I can't say I had a difficult situation. But yeah, I mean, as I mentioned, just showing care is very important. He would feel home. Most of the patients, when they leave, they tell me, I literally felt like I was home. And here comes something I posted on LinkedIn earlier this week. And it was a note on my laptop when I was in sales. It goes like this. I hope I remember the quote correctly. It was, people doesn't care what you know until they know how much you care.
Okay.
Interesting.
Okay,
so, if you have too much knowledge about something, but you're not just throwing me information, it is going to feel a little bit awkward.
Especially when he feels that you are only selling me.
Exactly.
No care.
But when you're showing me care and then you're feeding me the information, I'll be more...
Exactly. That goes back to the verbal and nonverbal communication theory by Dr. Albert Mehrabian, where he says that 7% of communication is words. So words actually have the smallest occupation of communication.
Yes.
5 times more important than words is your tone of voice. And even around 10 times more important than words is your body language. So definitely what you said hits all the spots because you show care not only with words. The patient speaks German. How much can you speak German to the patient? You can't, right? But the body language, the insinuations, the nonverbal cues are what showed the patient that you actually care.
Exactly. And it was really funny because when they come, I knew they're coming, they speak German. So I prepared
Some was like how to say hi to say welcome.
Yes. So it was really good showing them that even though there's a language barrier, we're still going to move on with the procedure.
Yes.
And I think you should be prepared before meeting any patient. This is like, for me, is like a ritual. Even just picking up patient from the door to the door, I have to be prepared. Because as you mentioned, the body language and the tone of voice is very important. And when you get exhausted during the day, you get drained, like literally. You're not supposed to show this because the patient is already in pain. You're not also showing him yourself you are tired. So you have to be mentally prepared to meet the patient.
Always say, I'm always saying to the people working in the clinic, before like meeting the patient, you need to ask the sales in the office to give him a short story about the patient's coming, what he like, what he doesn't like, something to know who we're gonna meet in the clinic. That could be like also better for both.
It really helps. It helps a lot but also they should be accurate about this, because sometimes we get a note from the salesperson that this patient is da-da-da. And then we meet the patient, he's an entirely different person.
Yeah.
So sometimes
over phone and face to face.
For me personally, I don't look at the notes because over the phone is entirely different.
Of course.
And also it might build some concerns to you that about this patient. So I remember like vaguely we had one patient and the note was the patient is very angry or is very it was some kind of negative impact. So when I read it, when I came to speak to it, I was a little bit defensive. And then get to talking with him, and he's a really nice guy. But then I was like, wow, like if I went with the mentality that he is just a normal patient, I wouldn't be scared or defensive, So then I was like, these notes aren't for me.
Yeah, actually, but also this adds up to another thing. There's a huge lack of communication between office and clinic in most of the clinics in medical tourism, Like there's always this lack of communication, even though in big clinics or small clinics, we see this a lot. Sales agents in the office, when they send notes, what do they say? Patient can be interested in this. You can upsell them that.
Only about the money part.
Yeah, exactly. Okay, what about the character?
Yeah.
What about the patient? What about what are they really interested? What about their pain points? Nothing about this.
Yeah, and I think this is really valid point you just mentioned, is talking about who is the patient more than how much he's gonna pay, what we are going to do.
Yeah.
When you reach this point, it's gonna be easier to get to the other things.
Exactly.
You can sell him easier. You can be friends with him.
Yes.
Based on the note that you got. And I think the communication should start between us as teams before we communicate with the patients.
Yeah, exactly.
Turning from this, how you manage patients would be who may be stressed or dissatisfied, anxious in the clinic?
Okay. I think most of the patient, they're anxious. Most, like, I would say.
He's coming to something new.
Yeah.
New country.
It's not about new. I had patients that just stressed of the idea of being on the dental chair. And I had once a patient who just like touching the instrument, the doctor who touching the instrument, it just shakes. So we have several things to do. As a treatment, we use like sedation treatments. We go for some, but as a personal communication or personal encounter with the patient, you should look relaxed. You should use a low tone when speaking with the patient.
Exactly.
And I prefer to use different terms. For example, I don't say pulling your teeth or extraction. I use
taking your
removing your tooth or doing your implants, not like drilling your the bone. These terms really scares a lot of people.
Yeah, there's always multiple ways of explaining everything, right?
Exactly.
Like an implant can be drilling the bone, cutting the gum open, drilling the bone,
exactly,
and then putting a screw inside.
Putting a screw. Yeah. No one says that.
That's one way to explain it.
For him.
Another way to explain it, it's a 15-minute procedure where you will have an implant for lifetime that looks like a tooth and acts like a tooth, and you will have no pain.
Totally agree.
Same way, right? You're
Totally
explaining the
agree.
same thing, but
Because
two different languages.
I encountered both situations, and I think I saw a lot of difference after using different
terms,
after using low tone, after like offering some coffee, tea. They feel a little bit relaxed, and I think the environment plays a lot of
roles
into this, like having some music around, comfortable chairs. This really helps. And also, probably, I would say this is something I noticed in different clinics here. They're not using the white color. Everyone is changing.
I hear about white color is like
it makes you feel hospital. Yeah. And when I see patient first day they arrive, they're just taking videos in the clinic because they like the environment and they feel less stressful watching like different colors, nothing white. Even our doctors, they don't wear like white. They wear like different colors.
Yes.
But as like
that's a very smart strategy,
which is really smart. Yeah, it helps a lot.
It actually brings up my next question, which is very important. Like, you have a very unique experience meeting with patients face to face. So definitely you have some certain things like that you do. These things might be very small. These strategies might be very small or very big that you use to increase patient satisfaction.
I think I do. Exactly. But I was trying to remember what like the most thing I can use. I think showing care as the first thing you mentioned before. Good communication and showing that you actually care. Not fake smiling or not just doing the job. You have to be in this situation with your mind and your soul, because here's this patient coming from different country. They having problem. They very stressed. You have to be there for them, not just just doing your job. This is entirely different than doing your job.
Yeah.
This is being there for a different person.
Of course, empathy.
Exactly. You have to empathize with them and be in there, putting yourself in their shoes.
That's what he feels.
I was trying to reach this word.
Good one.
Put yourself in shoes of the other person. This is a great example in real life, but for us it works way much better. Patient experience. When you imagine yourself doing this, how do you want to be treated in this situation? And this is for me was game changer. This is literally game changer. And sometimes I feel like some patient being rude, but then when I think if I was there, I would be rude.
You may lose it. Yes.
I would. So I would be like, calm down, we will fix it. We will. And also using different terms, but in this situation is different. Like, let's say the patient waited so much, and it happens a lot. So instead of telling them, sorry,
we were busy and
sorry, we're busy or something, it's like, thank you for waiting.
Yeah.
Okay.
Exactly.
Always looking for the positive side.
Exactly.
Yeah.
Because I'm not also playing. I'm doing my job. I had some complication. I had the patient late, which is not your fault or my fault. It's his fault. But thank you for waiting. Let me offer you some coffee, and we will take you as soon as possible.
Yeah.
So it's all about how you treat.
It's about the treatment. It's about thinking. What would you do if you were there? How do you want to be treated like this? This really is
maximum empathy. Right? This is maximum empathy that I've ever seen.
Yeah, I mean, you put yourself. I mean, who's important than you?
It really shows the core of patient experience.
Exactly.
Right?
Yeah. I mean, it's only just empathizing. It's really like the only word you can use in this situation.
And from your experience, what makes clinic stand out in terms of patient experience?
Yeah, very good question. We see some clinics with terrible patient experience and some clinics with very good patient experience.
Do you know how many patients have been running from the clinics, or we call them like, I just run out from this clinic. He saw something like suspicious, like, or he will be waiting more than 2 hours.
Once I had a patient who told me that I told him I'm going to the bathroom and
it happens.
Even if he paid.
I know. I mean, but what makes the clinic stand out is following up and communication. I mean, but it should be like very clear, not just telling the patient, okay, 15 minutes, I will take you to the doctor. Should be like, you're supposed to be at this time in the doctor, but we had a complication. We had to extend the patient before you. Then we will take you. It will make him feel that he's actually informed what happened, not just 15. What happened in 15 minutes?
Exactly. That vagueness.
Exactly.
That vagueness, or being uninformed or not knowing what's happening around you is so terrible.
Exactly. So you should be clear and you should follow up. Following up is very important because, as I mentioned before, some patient, they say, we didn't know why we are here. We didn't know what we're going to do here. But when especially the patient who will come for a surgery, like implant, it's for them, it's like big implant surgery is opening the gum, is bleeding.
For us, working this industry, implant for us is like,
it's nothing.
but for them,
for them, it's the first thing that they're going to do. And they need to be mentally prepared. I met a lot of patients who told me, please tell me what I'm going to do because I need to be mentally prepared. Especially the anxious patient. And also the others who like very busy people, they say, please let me know what's going to happen because I have schedule, I have meeting, I have to do this, I have to do that. So communication, following up, and being clear. Being clear with anything. During the sale, during the what you say, like the consultation with the doctor. This should be clear because even after I get the patient after the sale, sometimes they keep asking me questions. Like, and I was wondering, weren't you there? Weren't you explained everything? Nothing was, which is not being clear. That's the reason. If they come to me, they know what they're gonna happen. It will be more easier for them.
I'm always wondering, patient doesn't speak Turkish language. And most of doctors are speaking only Turkish.
Yeah.
So when you're being with the patient, doctors are like delivering all the information to you and you are saying with the patients. Does the patient feeling sometimes like uncomfortable in this way? Like, they are speaking different language. I can't understand what they are saying.
Most of the time. Yeah. And especially the patients who are the anxious ones. When they hear different language, they say, wow, what's going on?
What you are saying?
And they're like very focused on your face. And it's like, your face changed. Like, oh, the implant is failed, Once, I swear, one patient is like, looked at me and I was looking at the doctor, we were discussing, it's like, did the implant fail? I was like, what? Nothing. Everything is okay. We're just discussing your appointment. It's like, So for me, knowing that in this position that I have to translate every word at the same time. It's like the doctor just said this is and this, we have to do
transparent
this now.
and honestly.
Yeah. And it is actually, it makes a couple of patients uncomfortable.
Sam, I think working as a patient experience specialist, just like what you said, with a lot of patients coming on Mondays specifically, is so much draining physically and emotionally. How do you maintain to keep up until the end of the day? Like, how do you keep the smile and the empathy until the end of the day?
The gym.
That's a message for everyone who's watching. Go to the gym.
Go. Show up.
Relieve from the stress.
I think sports was very important thing for me. Relieving all the stress. Going after. I go in the morning. So I go prepared. I go fresh.
I can feel it. I know that's feelings.
I go fresh, and I start fresh. What changed? I used to go after work, and then what changed my mind is going fresh in the morning, and then when I finish, my energy will be definitely drained. So I have go
you
home and sleep.
You cannot go to the gym.
I cannot go to the gym. So
we pump into each other multiple times in the gym in the morning.
Times, yes.
Phenomenal.
I think also music.
Oh, okay.
Yeah,
what type of music, for example?
For me, it's jazz.
Jazz. That's so relaxing. Thinking about it is so relaxing.
Yeah, and you get a patient like getting all this music.
Well, for me also, I have this like special technique. I'm gonna say it to you guys. You can use it. When I encounter a very stressful situation, and I have a bit like for 5 minutes, I go to any chair. Around me, but like on the side, not in front of everybody. I put my head back and I visualize all the negativity and the bad thoughts falling out from the back of my head.
Oh,
okay.
It's about visual, it's visualizing. It's imagination.
Yeah.
And breath work.
You breathe in a certain way.
In a certain way, and just close my eyes and visualize this. It really restores my energy. Even if a little bit amount of energy, but it really does. It does me really good.
This advice is gold, because the brain isn't able to differentiate what's real and what's not. If you visualize the negative thoughts going out of the brain will believe these thoughts are gone.
The brain runs the body.
Yes.
I'll say something. Yeah. I get a lot of employees who was working in the clinic in patient experience. And they worked like for almost 1 month, 2 months. They are coming saying, I can't make it anymore. I need to go to a therapist. I can't handle this anymore. The pressure from the patient, sometimes yelling, doing something. So right now I can understand what they are feeling in the clinic.
Well, I can tell you after 2 years, I am the therapist.
For yourself, right?
I am the therapist of the patients. And for me, I think most of the patients, they really like to talk. And they don't have the chance to talk to the doctor because they're just coming to do the treatment. So here comes the therapist.
Yeah, 100%.
So yeah, I mean, talking, and I let them talk. I'm a good listener. I let people talk, speak, and because it also plays a good role for me because I am, in the end of this, I'm going to get the satisfaction of the patient. I'm going to get my review. I'm going to get the video. It's win-win.
It's a win-win situation always.
He will get the good results and I will get
You will feel good and you will get what you want.
Definitely.
Exactly what you said. So, Sam, what kind of advice you can give it to the clinics to improve their patient experience or their patient satisfaction?
We should focus on the people who are working on the patient experience. We need more training for this because I figured out all that by myself.
Thank you.
All the thing that I mentioned now, sorry.
It's okay.
I figured out myself. I following some personal things on YouTube. That's what told me. I mean,
Sam, this can open the door for you actually, because there's a gap in the market that you can fill, right?
Well, I'm ready.
You can become the patient experience trainer in this field.
Because after 2 years, I can tell you exactly what you can do to avoid any conflict with any patient or any wrong or bad situation, misunderstanding, difficulty. And knowing this by myself, I would definitely give very good advice about this. But, it's not my time now. I wouldn't do that. But I can say, put yourself in the patient's shoes. This is number one. Being empathize about dealing with the patient. Empathizing is very important. Okay. And mostly knowing what the patient wants. Because some patients, they don't speak too much. They just say, okay, I'm coming to do this. And in the end, we do surveys with the end of the treatment. And we were surprised with some of the answers from the patients. Nobody told me this, nobody told me that. I wasn't comfortable. But when I came and asked them about something, they don't speak. Because you're not... the ice is still there. You didn't break it. So you have to break the ice so you won't reach this point when after the patient leave, he's still holding some bad energy and bad thoughts.
100%.
Sam, I believe I can see your name a lot in the reviews in all the comments. That's happy patients a lot.
Yeah, I think because for me, being friends with the patient in some level, we're like literally being friends. So, and sometimes when I come, some patient they just ask for me. They don't want to deal with anyone. Yeah, where is Sam?
We saw him in the reviews. Where is Sam?
Yeah, and it was really funny because the other day I came in the clinic in the morning. I just got my coffee, and three persons staring at me. And I was
like, are you Sam?
Oh my God, what's going on? And then I was like, just walked right beside him. I was like, hey. I was like, hi, are you Sam? He's like, yes, I am. I said, can we take picture with you?
Oh.
I was like, oh my God. I was surprised, like, why? Said, we saw you on the videos and we would like you to be our coordinator or something.
It's
I
really
was
for me happy to hear that.
well,
So,
I will.
This goes back to the point where you should train others on patient experience.
Maybe I would consider that.
One day.
we hope so. Also.
Because it was actually from one of my patients, and he sent their friends, and they were like literally even they won't handle the information to the front desk. They was like,
before
where
seeing
is Sam?
yeah.
So I came, then they started. It feels really good. It feels very good. Yes.
Phenomenal.
Happy to hear that.
Well, Sam, we would love to thank you so much for all of these wonderful insights that you have provided. It has been really one of the best episodes we've ever made.
I appreciate it.
Hearing all of this about patient experience definitely shed the light on so many missing things, because it's all about the sale. It's all about making more sales, but what about the experience? That experience brings in more references.
Definitely.
And successful companies are ones who have high reference count, because it means they are nailing everything correctly.
Experiencing good time in the clinic.
Yes, exactly.
It definitely brings you more people.
Exactly.
Results
And not just the people they know, the people that they encounter in some places
they will
outside.
take effort to send people your
Exactly,
way because of that experience.
The other day, a patient came. He said, I met this patient who was in your clinic in my hotel. And I just walked down the street to your clinic because he just told me about your clinic and it seemed very interesting place.
Yeah.
So this is just like organic,
Yes, 100%.
So yeah, it's being careful and being clear and communicative with the patient. It will bring you a lot of
the best.
So much happy to hear that.
Sam,
thank you
so much. Thank you so much for joining us today in today's episode.
I appreciate your time.
Thank you for having me.
It was eye-opening to know more about patient experience. Thank you so much for all the insights.
Thank you
and a huge thanks to all of our audience for watching today's episode about patient experience with our special guest, Sam. Thank you so much for sticking in, and stay tuned for more upcoming episodes with more insiders from medical tourism.